to the 29th meeting of the 46th year of the Rotary Club of Dublin and Worthington. Today's invocation will be offered and Pledge of Allegiance will be offered by Tim Motes. Tim?
You be in an attitude of prayer with me? Our Heavenly Father, you give us so much. You bless us beyond measure. Too many times we focus on what we don't have. Forgive us, Lord. Help us to focus on the things we do have. We thank you for Rotary and the opportunity that we have to serve. Make us ever mindful of and responsive to the needs of others. In your name we pray. Amen.
Amen.
I pledge allegiance to the
To
flag,
the flag
of the
of the United States of America,
to the
and to the republic for which it
stands,
stands,
one nation,
one nation, under God, indivisible, with liberty and justice for all.
Okay, thank you, Tim. I appreciate that. And so, President-elect Steve, do you have any collection of happy dollars and introduction of guests?
Absolutely. And we have, of course, our speaker, Melanie Hankinson, who will be introduced later by Teresa. But I do see a guest, Brian Griffith, who I believe may have been a former member. So welcome to the meeting, Brian.
Yeah,
Glad to have you here.
good to see you.
I think that's it. So then let's go to happy dollars. Who's got one? Shout
I
it
have
out.
a happy dollar because it appears that the weather will be very conducive to our food drive on Saturday. And some of you have been so busy that you haven't volunteered as yet. So please contact Andrew and add your name to the list of volunteers. It's 9 to noon on Saturday, but if you can't spend the whole time, that's okay. Sign up and volunteer. Believe me, you'll like it.
Who else has a happy dollar?
I do.
Go for it, Katie.
I have a happy dollar that now 40 and up or can get their COVID vaccines. Makes me a happy girl. So I'll probably be one of first in line and dragging my husband along with me.
Good.
Yeah, you stole mine that I had in my back pocket. I was pretty amazed to see that 16 and up is going to be open by March 29th. I think that's just phenomenal.
I think it's awesome.
So I'm looking forward. Jim and I are going to be talking at the board tomorrow about reforming the hybrid meeting task force. So hopefully we'll have some positive news to share there in the coming months. Maybe I should have shared that now. Sorry, Jim. I don't know. Whatever.
No, that's quite fine.
Yeah,
I think you're right that we may have some positive news coming.
Yeah. Can anybody else finish us off with one more happy dollar?
Joe does. Looks
Yep.
like Joe.
I do. I'm happy that in continuation of a long tradition at our office, we are going to have the Shamrock Pipe and Drums give us a concert today. Now they'll be doing that in our parking lot because of current viral conditions, but we've been doing that for years, and it's not St. Patrick's Day unless very, very, very loud concert happens near or in our office.
Is that what prompted you to put on a tie today, Joe?
No, this is also momentous that I had to wear a tie today. This is the first time I've worn a tie for a year because I have to go to court today. And no, I'm not a party. I'm the lawyer, so it's all right.
I just wanted to kind of remind you, Joe, when I saw how you were dressed, that this is not a billable hour.
Oh, someone is getting charged right now. Just not you.
Bagpipes are a wonderful parlor instrument, Joe. Too bad they have to be outside.
All right. Thank you, everybody. I'll turn it back over to you, Jim.
Okay. So next we have announcements. You should have gotten an email regarding we will be having our sponsorship drawing this year, and you'll be getting in the very near future more information on the sale of tickets, which will be virtual. They will not be hard paper tickets, and you will not have to turn them back in. So we're going to actually streamline the process quite a bit, and you'll be getting more information, as I said, in the near future. The drawing will be April 28th. Other announcements?
Jim, maybe you'll save this for the end, but we are going to have our annual club meeting next week. So it is critical, important that anybody that can attend does, because we will be voting on, well, now I'm embarrassed, board?
The board. Correct.
Yeah, we'll be voting on the board. That's what, yeah, I knew that. Well, yeah, that's what we're doing. So if you can make it next week, please do.
I have an announcement. Spring Rah-Rah is next week on the 24th, 4 to 6 p.m. It will be at Pins Mechanical, and we will also have, Cap City is going to bring individualized treats for us, appetizers for us, so we don't have to worry about transferring of any germs. I already have bought, I moved them. I already bought some large pumps for hand sanitizer for people, and we also will have a Zoom meeting. So if people are still not comfortable physically attending, we will have a not physical attendance that way too. So need to know your whether you're coming by March 19th. That way I can contact Cap City and get them all straightened out. And if you're not attending, I'm sorry, I'm not going to do food. All right, thank you.
Rich, do you want to make an announcement today?
Sure. You should be getting an email in the next few days through Jim about the Paul Harris Fellow Community Service Award that the our club's board has sanctioned. This is not for members of the club. It's for leaders in either the Dublin or Worthington community. With the email, you'll be getting a form, a nomination form if you want to nominate someone that you feel meets the criteria, but you just don't give the name. We would like you to explain why you're nominating them. The form basically asks you a few questions to answer to help explain why you feel this person should be granted the award by the club. We're doing up to 3 awards during a particular Rotary year. I am going to be chairing a committee to consider those nominations. So I encourage anyone who is interested to join me on the committee until we get further along in the pandemic. Any meetings that we would have, I would do by Zoom. So no one should be concerned about that. So just let me know by by email. That will be my email address. That will be in the email that Jim sends out. If you're not only to send in a nomination form, but to participate with me as part of the committee to consider those nominations. Thank you.
Others? Let me check the other screen. Okay. So today's program will be introduced by Vice President Teresa. Teresa?
Yes, so I'm excited to have Melanie with us. I think she's a huge resource of knowledge and information that could be very helpful for some of us on the call. She's been instrumental in helping my family, my in-laws, with some of the questions they had when they needed to make decisions with their living and livelihood. So Melanie started iCore following an accomplished and diverse career in the healthcare industry. As the owner and managing director of iCore, Melanie leads a team of patient advocates and personal needs coordinators who work every day to improve the lives of seniors in the greater Columbus area. Melanie holds a degree in physical therapy. She is an aging life care professional, a certified senior advisor, and a board certified patient advocate. These professional credentials, along with over 2 decades of experience working with healthcare professionals, give Melanie an unmatched understanding of the resources and tools available to help seniors overcome the challenges of aging and navigate life's transitions. As a volunteer guardian, Central Ohio Agency on Aging for the past 5 years, Melanie has been called on to make important life decisions for her ward. Through iCore, she works to help seniors and their families avoid guardianship. iCore of Columbus is honored to be trusted by the courts to provide guardianship services to individuals. And she also helped a client of mine that was being exploited by his grandson, and his financial account was being liquidated. So Melanie is an amazing resource, and you'll hear all about it. Thank you so much. Take it away, Melanie.
Thank you, Teresa. I really appreciate you having me today. And of course, your guest, Brian Griffith, is someone I know. Joe Patchen probably doesn't know me, but I know him. So there's a couple familiar faces here. So I am considered, some people call me a geriatric care manager. We're trying to move away from the word geriatric into the word aging. So and now we're called aging life care professionals, but many people don't know what that means. So I help in every aspect of my clients' lives in the aging process. So I'll talk a little bit about what I do, but I really am focused on care options, just like what Abe was talking about. You know, he was going to go to assisted living facility. Those are types of things that I help guide people with. So about iCore, okay, now I'm gonna, okay, here we go. I got it working. iCore stands for integrity, knowledge, objectivity, reliability. When I started iCore in 2016, it actually was a franchise. So I didn't come up with the name and I didn't rebrand. So we're sticking with it for right now. But that's what it stands for. So a lot of people ask me.
Hey, Mel, 1 second. I'm so sorry. You're not sharing any slides if you were intending to at the moment.
Oh, I am intending. Okay.
So if you hit that green share screen button again.
Okay, so that one, I'm going to have to share every screen.
Just the way we did it before, that would work. Because I stopped sharing it from when we previously did the test.
All right, hold on.
Okay.
See, we're all getting used to Zoom, me included. Now, what do you see, Steve? Yeah.
We see the PowerPoint, but it's not in slideshow mode. So if you just hit from current slide or from beginning, whatever you want. Yep.
All right. Well, so if I move that, do you still see it, Steve?
Yeah, we can see it perfectly. We're on
Okay.
our values screen. That's what we see.
Okay, good. Perfect. Thank you. Sorry for the interruption. I talked a little bit about this, an aging life care professional, but see what we do is when people call me, we usually assess their situation. We look at what they need or what problems they're having. Sometimes they don't even know maybe what they need or how to move forward with the situation that they're in. So then we usually coordinate services for our clients, manage those services, and then as things change, because they do often, our plan changes. So we sort of put a plan in place. Some days the plan changes on a daily basis. I've had people this year during COVID, which they were in the hospital. They thought they were going to come home in a day or two. They didn't come home. Then they thought they were going to go home. then they went to a facility. So it just, we sort of like roll with the punches and adapt and make those changes. So Steve, if you not see my slide, just stop me again. Okay, but I think we're good.
No, we're
So
good.
what do we do? People think we do everything but provide care. Most people are not familiar with this type of service. So they might think we're a home care agency and that we have caregivers. We're not that. I have a registered nurse on staff and a social worker. Teresa introduced my background. I have a physical therapy background. So it's the three of us, and we're looking at everybody in a holistically, and then we make recommendations. So the key is we don't provide care. That's your takeaway. So we're looking really at 4 pillars. We're looking at the medical situation, the environment, finances, and emotional, which is very, very important right now during this time of COVID. So the medical aspect, what we're trying to do, particularly when people are living at home, we're trying to avoid that ER visit. So my nurse, who's a registered nurse, BSN, has 35 years of experience. Maybe she'll come to the house, once a week, twice a month. We're looking at vital signs. So she's doing a nursing assessment, looking at skin integrity, looking at vital signs. Sometimes we're doing the medication management, and we're making sure that they're aging safely at home on the medical aspect. And then if there's an emergency, we do crisis management. So you call us. It doesn't matter if it's 3 a.m, we answer. I might be groggy, but somebody will answer, and we're going to be there to help you. And some might be, is it time to go to the emergency room? So we might just talk through that situation. We go to doctor's appointments with people. I spoke to a woman this morning that she's a busy professional. She doesn't have time to go to a doctor's appointment because you go to a specialist. And again, some of this is pre-COVID, bear with me, but they're going to a specialist. They have to wait 30 minutes. They finally get in to see the doctor, and maybe you don't know what questions to ask. Where my nurse, if we get your backgrounds and, have your med list, know the client, we're going to know what questions to ask, or she is. So we can then relay that information back to the family in layman's terms, because not all physicians are speaking in layman's terms. And a lot of times our clients, they have hearing problems. They're not knowing what the doctor said. So they maybe come out and, daughter, son goes, how did it go? Oh, everything's fine, and that happens more than you might think. So that's the medical aspect of our business. The environment is, are you aging in place in your whatever setting safely? Many people want to stay in their homes. Absolutely. We are all about honoring our clients' wishes, but sometimes it's just not a good setup. So we maybe make modifications to the house. We make recommendations for modifications or just safety features. I had a client during COVID that was a split level home, and she was coming home from the hospital, but she couldn't walk. And I'm like, well, wherever we put her, she's going to have to stay for the time being. And then hopefully she gets better and then she can go down the stairs. But we have to think about the current situation. And then you have to think about a bathroom, whatever floor you're on, do you have a bathroom? And not just, a toilet and a sink, but a shower or a tub shower. And is that going to work with getting a shower if people can do that? When people are no longer able or want to live in their current home situation, we assist with finding a good match for their facility. Again, Abe talked about not wanting a religious facility. What he's talking about, Friendship Village, is a continuing care retirement community, which we'll talk about later. But we try to find what the person or couple is looking for, and then making recommendations for an appropriate community. And then, of course, that goes into the cost. How much can you afford for an assisted living facility? How long can you afford it for? So say your income is $4,000 a month, but the assisted living facility is $6,500 a month. You're taking from some sort of savings. So how long can you afford to do that? The emotional aspects, we're just making sure if people are aging in place, they're not isolated. This has been a very difficult year. I lost 16 clients last year, which is a lot of people because we only have a caseload of like 25 to 35 at any given time, and 16 of my clients died. Only one died of COVID. We could probably attribute one or two of more of those to isolation. And one was an assisted living facility, but they were on lockdown. You didn't leave your room. So we sometimes didn't leave our house. Can you imagine not leaving a room? It's just devastating to people. So back to the financials a little bit. So I work with Teresa, I've worked with before, because we're trying to, when you're talking with your clients as a financial or wealth advisor about healthcare costs, you want to look at the future of what does that look like? And many people are very surprised of what does care cost as you're aging, and are you going to be able to afford that? And many people can't. So that's sort of the four aspects that we look at. And we do pretty much everything. I know I said everything but care, but I can't tell you the things that we've gotten into. And this year, two of our clients passed. Their families, one, they were in their 70s because my client was 94. They didn't want to come up from out of state to help sell the house. So I found a realtor. We did updates to the house. We did landscaping, things of that nature, and then we got it listed. So I did all of that sort of like a project manager for my client, and I did pretty much two houses like that. But so we sort of added that service last year because it was this year, just because it was necessary. So let's talk about care. And I can't see everybody because I only have you, like 4 of you on my right. So Steve, if you see somebody like putting their hand up, just, interrupt me. I like this to be real, having a good conversation back and forth. So
Melanie,
home care.
Melanie,
Yes, Teresa.
it's Katie. It's
Oh,
somebody.
Katie, I'm sorry.
Yeah, that's okay. Just want to let you know you can scroll up and down on the 4 images you can see. So there should be like a scroll bar at the bottom, so you can.
Okay, good. I probably won't scroll and talk at the same time, maybe.
Yeah, not a good idea.
No, I might get distracted and totally go off, but maybe one of you.
We'll look for questions for you. Don't worry about it.
Thank you so much. Okay. So home care. Home care is non-skilled care. So that means it's not going to be a licensed professional like a nurse or a therapist. This is custodial care. This is companion care, somebody that will do help with ADLs and instrumental ADLs. So transportation, so driving someone somewhere, grocery shopping. ADLs is dressing, bathing, household chores, light housekeeping, meal preparation, things of that nature. So when I say home care, it's non-skilled. So if we can just think of that. Home health care, which sometimes people get that confused, is a skilled service is so someone like a nurse is going to come in or a therapist. So for nursing, it is going to be like you have a wound. Okay, you had a wound, and you need something, wound management, something like that, dressing changes, things of that nature. Therapy is physical, occupational, and speech therapy. So you would have to have a doctor's order for this to have home care in your house. And you will have to also be homebound. Homebound meaning that you could not leave your house independently. You would have to have someone drive you there. Otherwise, you would need to go to outpatient services, outpatient therapy. Respite care, say you have a loved one living with you and you need a break or you need to go on vacation. There is respite services. They're usually in a community, a facility, and they might stay from a week to, say, a month. Sometimes they have a minimum, sometimes they don't. So that's respite care. If it's giving you a break. Adult daycare, it's where people go out for the day. It's kind of like daycare for adults. So think of it that way. So if you have kids and they go to daycare, it's the same thing, but it's for adults. They're doing activities. They're there for so many hours of the day, etc., and they come home or come back to wherever they're at. Hospice care is, I don't want to say end of life care because I'll talk about hospice in depth, but hospice is a wonderful service for people that are not going to get better in their aging process. So I have a client right now that he's doing very well, but he does have metastatic prostate cancer. I put him on hospice because it's an added benefit. So don't think of hospice as you're dying next week, because hospice is so much more than that. Then there's independent living, assisted living, memory care, skilled nursing. Independent living is, it's like an apartment. It's like you have an apartment, but you're in a community that they're all aging adults. They usually have, some of them look like hotels. John, are you trying to say something?
Sorry, no, I think he's just trying to get connected. So
Okay. So assisted living is just that. You need some assistance with some care. Memory care is a locked unit in a community for people that have memory impairments that possibly are going to elope. So you put if you put somebody in assisted living and they walk out the front door, that's not going to work. They're going to have to move them to memory care. Usually assisted living and memory care is in the same community. Since this is Dublin, so I don't know if anybody knows PAL Senior Living, but PAL Senior Living has an independent facility, and then behind it, and it's a different building, and has assisted living and memory care. They do not have skilled nursing. So skilled nursing is when you're first going to possibly rehab. So say you went to the hospital, your loved one was there for a couple of days, or they had, a total knee replacement, things of that nature, and they're going to a skilled nursing facility for rehab. That's also long-term care too. So it's not only acute, but it's long-term if they need long-term placement and they need that type of service. And then a continuing care retirement community is independent, assisted, and skilled nursing all on one campus. So Friendship Village of Dublin, they have all of those services, all of those levels of care on one campus. So if someone goes and maybe they started an independent or assisted living and maybe one day needs to go into skilled nursing, you're not going to have to move You're gonna have to move buildings, but you're not gonna have to move locations, if that makes sense. Any questions so far? So I'm gonna get into cost. This is great, there's wonderful services. Well, how much does this cost? So home care, again, let's think of custodial care. This is someone helping with bathing, dressing, meal prep, light housekeeping, stuff of that nature. This is private pay for the most part. There are some caveats to that. If you're a veteran, VA will pay for some services. That goes through VA benefits. Usually when they look at something, you have to have you need assistance with so many ADLs. So you would need assistance with like meal prep, bathing, dressing. So maybe usually 2 ADLs you need assistance with to get that benefit. Long-term care insurance. If you have a policy, I usually review the policies. They can be written they can be confusing, particularly when they were written. I mean, if they were written 30 years ago, it's just not the same sort of verbiage we use now. So I will review long-term care insurance policies, try to get those approved. I won't go too much into that. That is sometimes they're difficult to be approved. So just FYI. And then Medicaid passport. So again, it's usually on a sliding scale. You have to be eligible for Medicaid. There's a process to that as well. So most of this is going to be home care is going to be private pay. Again, there's exceptions. So $27 to $32 an hour. Let's average that. Usually, if you're only using home care for, say, 4 hours a day, 3 times a week, you're going to look at a higher rate. So that might be $30 an hour. The more hours you use, usually it can go down. 27 for a decent home care agency is probably going to be the least expensive in the Columbus market. This is very important. Cincinnati is going to be last, so we're really looking at Columbus. Home health, that's when you need a nurse or a therapist, you need a doctor's order, and your insurance or Medicare is going to be picking that up. Now, there could possibly be a copay, but again, insurance, the majority of that is going to be paid for by the insurance company. Respite care. Again, that is when someone is going to a community just for a relief stay, a respite stay. Usually it's a week to a month. It's private pay and it's at the facility daily rate. So whatever their daily rate is, that's what it's going to cost you for a respite stay. Adult daycare, that's mostly private pay. And again, adult daycares are not open right now, but daycares for adults, private pay, sometimes Medicaid, again, will pay for those services. The daily rate's about $70 a day. Hospice care, it's a benefit through Medicaid or Medicare, Medicaid. So it's a wonderful service. And I can't talk enough about it. And again, I don't work for a hospice company, but we refer a lot to hospice for our clients. Any questions? All right. Independent living, private pay. There is nothing around this. It's private pay, period. If you go to a continuing care retirement community, so I'm going to use Friendship Village of Dublin as an example. Depending what level you go into, say, if you're going into an independent living or assisted living, there could be an entrance fee. That entrance fee for continuing retirement communities starts at about $60,000. That can go up above $300,000. It depends on the environment you're looking for. So if you're looking for like a condo, think of a condo, but it's on the campus of a continuing care retirement community. Sometimes that interest fee is, $300,000. You pay that, and then you have a monthly fee on top of that. Lots of different options there. Sometimes you don't pay that, or you pay a little bit and then you pay more monthly, etc. And then that's for one person. Now, then if you're having a spouse or a second person, whomever, there's going to be an extra monthly fee on top of that for, usually $2,000 to $5,000 a month. Assisted living. So again, think private pay. There is an assisted living waiver. You have to first qualify for Medicaid. Then you have to find a facility that will take assisted living waivers. In Franklin County, I think there's like 16 facilities. These are not the nicest facilities you would want to go to historically. Many times they want you to private pay for a period of time. So maybe they'll 12 to 18 months or 12 to 24 months historically is what they want you to pay. And then they'll say, we'll keep you if we have a waiver bed. So what I usually historically do is work with the families and work with the facilities to look at the contract and make sure, and again, you can discuss this with an attorney to make sure that they will not just kick you out if you pay that period of time and if they don't have a waiver bed. So we look at the contract and try to work with the facility on that because they can easily do that. So assisted living, it's all on room size. There's studios, 1 bedroom, 2 bedrooms. There's a base price, and then there's a level of care price. So maybe you come in at, $3,800, but your level of care, and level of cares usually go 3, 4, or 5 levels. Every assisted living is a little bit different. So maybe a level care, the next level of care is an extra $700 a month. So you add the $3,800 plus the $700, that's your monthly, cost. Plus, there's extra fees sometimes as laundry, sometimes that's in the base price. It really depends on the facility, but this gives you a good overview. Any questions so far? Okay, memory care. So memory care is going to be like an assisted living, but it's a locked unit. Historically, assisted living facilities do not have a level of care. It's one price, and it's based on usually the type of room that you have. So again, you're looking at usually at the bottom of 5,500 to 7,000. It can go up from there. There's specialized Alzheimer's facilities that's all they do. There's no assisted living. It is just a memory care facility. One example is Ganshorn in Powell. I have a couple clients there. You're looking at least $7,000. Okay, so it can get very pricey. Skilled nursing facilities. Again, if you're going into the hospital, and it depends on your payer source, whether you have Medicare or you have Medicare Advantage plan. Some require a 3-night hospital stay, then they'll pay for rehab. But when you're going in for rehab, ideally, it's going to be paid for by your insurance. If you have Medicare, not an Advantage plan, if you have Medicare, they're going to tell you, how many days. As long as you're making progress, they'll usually pay it. A Medicare Advantage plan, the Medicare Advantage plan usually tells the facility how long they will pay. So usually whether it's twice a week, once a week, they have to submit information to the insurance, and the insurance goes, yeah, you can keep her for that person for another couple days and it'll be covered. After that time frame, if you're going to stay there and it's not going to be covered by insurance because you're not skilled, you don't need therapy or you don't qualify, that's all private pay. Unless, of course, you are spending down and then you get on Medicaid. A good round number for a skilled nursing facility is $300 a day. It's a good, easy number. Some are going to be $280. Some are going to be more if you want a private room. But if you're looking at cost and how much things cost, $300 a day is a very good average. Again, the numbers that I'm giving you are Columbus, and they're going to be probably on the nicer end because I'm private pay. My service is private pay, so the clients that I'm dealing with have the resources to pay for me. Genworth comes out every year with some cost analysis. So if you click on that link, and I hope that they share it with you, and if not, contact me. I'll send you the presentation. But Genworth does this every year. If you click on it, it's going to be 2020 numbers. And so that's a good resource for you as well. I'm running out of time because it's 12:43. So I'm going to try to go through this a little quickly. Home or facility. So this is pre-COVID. People, what's the pros and cons? If you're going, what do we need to do? We're not sure if mom or dad needs to go into a facility. Here's a couple questions to ask. Do they have the sound mind to make their own decisions? Are you respecting their wishes? And again, I'm a patient advocate, so I'm advocating for the client, and sometimes the family and I are not going to agree on what's best. But again, I'm a consultant. I give you advice. What you do with it is up to you. How much care is needed and how much is going to cost. So if you're looking at 24/7 care for a person, you're looking at about $18,000 a month. Can you afford that? And for how long? Because that's a lot of money a month for care. Is the home, are you able to age in place? Do you have a ranch house? Do you have, a full bath and a bedroom on the first floor? Is it split level? There's a lot of things to consider if you can actually age in place. You have to think of isolation, but right now, isolation of facility is just as bad as isolation at a home. What if there's an emergency situation? What if someone lives at home and they don't want to wear their emergency alert system, which is they just push a button and 911 comes. When are you going to have someone check on you? So does your daughter call every morning at 9 o'clock and you fell at, 10 o'clock last evening and you're going to be on a floor for 11 hours? It happens. I had a client this year that he was on the floor for 3 days. 3 days. He was a younger individual, younger meaning he wasn't in his 80s and 90s, or he wouldn't have survived. That he would have the skin would have broken down. But 3 days, and that's when he got help. And then are people able to take their medications at home appropriately? Can they remember? Do they have someone, help with the pill boxes, et cetera, et cetera? A facility, you're going to have 24/7 staff there. You're going to have staff there all the time. There's activities, there's socialization. Again, pre-COVID, they have your meals, they do your laundry, they clean, they have transportation in some instances. Again, you have to look at cost. You have to look at the change in environment from someone leaving their house because that's a traumatic event. You lived in your house for 40 years and now you just put them in a new environment. It can be it's a shock. It can be a shock. COVID, now we're in COVID. Home is safer. I mean, less people coming in and out. A facility, you can still be isolated. I had a gentleman in a Dublin facility. I moved him about 5 weeks ago. They were COVID. They had COVID clients or patients. So he literally could not leave his room. I brought in hospice. Hospice said he's going to die if you don't move him. So I moved him to an assisted living facility. During COVID, there's different regulations and how much leeway you have. When I moved him to an assisted living facility, he could have home care, so he could have that one-on-one interaction, and he's doing well. He's doing much better. That's it. I'm not going to go into any more because again, I'm running out of time. I'm talking. So caregiver facts, you guys know this. I mean, most of it, I'm sorry if the men are out there, but most of it falls on the woman and the children that are closer than if they're out of town. Health directive forms. We have a couple attorneys on here, so I won't get too much into this. All I would say is, please do, I don't care what age you are. I don't care if you're 28 or 88, do your estate planning. It's not that expensive. Go to an attorney to do your estate planning. Make sure you have your healthcare power of attorney. You don't want to end up in guardianship. You don't want me being your guardian and I've never met you, and now that you're incompetent, I'm trying to now understand what your wishes are. So don't do it. Brian Griffith's office has estate planning attorneys. Carly Patchen, they have Carlisle Patchen has estate planning attorneys. Go get an attorney and get your estate planning documents done, please. Here's my contact information. So we have a couple minutes left if you want to ask questions. I went through that quickly. I hope that it made sense. And of course, particularly now we're on Zoom and we're not in person.
Thank you, Melanie.
You're welcome. If someone doesn't have a question, I didn't do a very good job on this presentation.
I have one actual concern, and that is that during COVID, it appears that there's been a real challenge for staffing of facilities. And we weren't in the great shape beforehand in terms of level of skill based personnel, especially in care facilities that had high needs.
Mhm.
And do you see any relief of being able to attract both more personnel and higher skilled? Because that has, from what I observed, become a real issue.
So Jim, when you say staffing, are you talking about the caregivers?
Direct care, not nursing,
Yeah.
not rehab staff, but the direct care.
No, it's getting worse.
Regular day-to-day assistance.
So it's getting worse, and this is why. So an average caregiver is making anywhere from $11 to $13 an hour. You can go sometimes to Giant Eagle and make 14 or 15. You can go to Amazon and make more. So it's supply and demand. They're not out there. You have to, number one, really want to work in this field, but you also have to pass a background check. So already you've taken some possible people out of that pool that you can pull from. Some people don't want to work in people's homes because it's every home is a little unique. It might not be as clean as they would prefer it, or the environment might not be what they're used to. Facilities historically are more, it's more heavy duty. I mean, sometimes you have to lift people. So the strain of in a community is more than historically in their home. But no, it is, it's a challenge. It's a challenge, and a lot of times, a lot of the caregivers are from Africa, not just they're Black caregivers, but they're actually from Africa, and they have a thick accent, and people don't want that because they can't understand them. So it's a real conundrum.
Well, one of the issues that I'm aware of is that both Medicaid and Medicare rates are fixed, are they not? They're capped is a frequent.
So do you mean in a facility or?
In a facility.
So you have there's a daily rate,
Mhm.
and it's based on, there's a calculation of what the rate is. Now, Medicaid could be half, could be less of that daily rate. So, if it costs $300 a day for a private pay facility, and you have a Medicaid client and you're trying to place them, and they're going to get, $170 a day. And I don't even know if that's correct. Don't quote me on numbers of Medicaid, but is that a patient you want? Does it cost any less to take care of that Medicaid patient versus the private pay patient?
Yeah. And the same goes for Medicare, correct?
Yeah, Medicare has a daily rate. Yes, they have a daily rate, but historically that rate is, much higher than Medicaid. And that is if it's like a rehab person. If you're completed with a skilled service, it's private pay. You're private paying that $300 a day until you run out of resources. Mm-hmm. If that makes sense.
I have a question about two things. First of all, what about the supplemental policies to Medicare? And the other one is the long-term insurance.
Mm-hmm.
The question is, how do you use all the things that you have per day? For instance, we have around $180 a day.
Uh-huh.
How do you use all that?
So if Abe, you said you were going into an assisted living facility. So in that assisted living facility, you're going to be using that $180 a day. Can you hear me, Abe?
Yes.
Okay, so you're maxing out your daily benefits, and then you have usually a lifetime benefit on your policy. So they say that's $300,000. When that daily benefit is maxed, and then your lifetime benefit is maxed, then your long-term care insurance policy would no longer pay.
Well, because my lifetime is, my policy is lifetime. I bought it 1 million years ago, and it was very early, and our policies say lifetime. So I'm theoretically, it's capped at $180 a day. So,
is there no lifetime benefit maximum?
Not that I've read. It says lifetime.
Okay, I would just review that policy. Make sure there's no lifetime maximum benefit. Historically, there is, but if you bought it years ago, the old policies are written differently than they are, say, 10, 15, 20, 25 years ago. So good for you, Abe, because you're in a very good position.
I really haven't seen that, but maybe I haven't read it in enough detail.
I'm sure it's a lot of pages. So review that. But the 180 days, $180 a day is decent. That'll get you, that'll pay maybe 2/3 of your daily rate.
And that work, okay. All right, I'm gonna have to deal with it, all right.
Thank you.
Thank you.
Oh, you're welcome.
We're about to transition, that's a problem. Oh, and the COVID, I suspect is getting better in the facilities, isn't it?
It is. So the facilities have already been vaccinated if people chose to get vaccinated. So they finished those up, I don't know, beginning of February, I think. So all the communities, again, if you wanted a vaccine, it was available to you. Whether
I'm concerned about the employees.
Correct. So you really can't, or at least from my understanding, again, I'm not an attorney, but from what I read, you really can't force your employees to get vaccinated. Again, my employees did, but it is a concern. However, historically, they're doing weekly, sometimes bi-weekly COVID testing. So before you move into that facility, Abe, I would just ask them about their COVID testing policies if someone is not vaccinated.
I'll just chime in real quick that yes, you can force them to get their vaccines.
Brian, you can. Everything I've read was you cannot because it was not. Hey, listen, you're the attorney. I'm not.
No,
so
he's right. That's what we tell people. That's the direction. It's impractical for a lot of people to lean on people to do that, but.
Was that Joe? Because
yeah.
I can't. Okay.
Yeah, I agree with Joe too.
I thank you for piping in. Well, they are the legal experts here, so listen to them.
We need to wrap up the formal part of the meeting. Can you stick around, Melanie?
I can.
And certainly anyone can stick on after we wrap up the formal part of the meeting. But we do need to allow some folks to be able to move on at this point.
Thank you so much. That was very helpful.
Yeah.
Oh, thank you. I'm glad it was helpful.
It is a very complex area, and you did give a lot of good information there. Let's see, what I would like to do is be able to talk a little bit about Kate Lalonde who is the director of the Historical Society, is the next week's program, and she'll be talking about the number of African Americans who have made Worthington their home in the 1800s. So that's what she'll be discussing in terms of next week. It should be very interesting.
Jim, are we doing that next week, or is that the annual meeting? Are they happening on the same meeting?
Yeah, it can be done in the same meeting.
Okay.
The annual meeting is not a very long piece in terms of the selection of board members.
Gotcha.
So again, thank you, Melanie. And in closing, I would like to have us all recite the four-way test and in fact ask everyone to participate. At the same time, I want to thank everyone for attending today. So under the four-way test, of the things we think, say, and do, first is it the truth. Second, is it fair to all concerned? Third,
will it build
goodwill and better friendships?
And fourth, will it
be beneficial to all concerned?
So again, thank you for coming, and hopefully see you next week, especially since it's our annual meeting and we do need a quorum in attendance. So please do attend. Thank you very much.
Thank you.